Hi, my name's Dr. Kate Bradman. I work in the emergency department at Perth Children's Hospital. Last year we saw over 70,000 children in our ED, and many of their parents asked, how do I know when to bring my child to emergency? Signs and symptoms that may require an emergency department visit include if your child is having difficulty breathing or they're blue around their lips, if they're drowsy, lethargic or not waking for feeds, if they have a rash that doesn't fade if you press on it, if they are injured with a broken bone, heavy bleeding or a deep wound. You should also take your child to the emergency department for other reasons, such as a serious head injury or burns, a fast heartbeat that doesn't slow down, a seizure, severe allergic reaction, or if your child has a fever with a headache and stiff neck. We also have the CAMS Emergency Telehealth Service that provides phone and online video call support for children and young people experiencing a mental health crisis. It also provides support and advice for their families and carers. It offers an alternative to presenting to ED and aims to provide expert help to children and young people quickly and conveniently when they need it most. If you're concerned your child is really unwell, you should call an ambulance on 000. Your GP or local after-hours urgent care clinic can deal with non-life-threatening emergencies such as sports injuries, strains and sprains, ear infections, coughs, colds and sore throats, diarrhea and vomiting, rashes that do fade with pressure, minor cuts and head injuries, and non-urgent mental health assessments. Please remember, you know your child better than anyone, so if you're concerned your child is critically unwell, please call an ambulance on 000 or go to your nearest hospital emergency department. These hospitals are located right across the Perth metropolitan area. They are open 24 hours a day, 7 days a week, and can treat children and babies in their emergency departments. Joondalup Health Campus, St John of God Midland Public Hospital, Fiona Stanley Hospital, and Armidale Health Service.